But my hope is that as you walk away with this presentation and the materials, that it will give you something to lean back on when you think about each child and family that you'll have opportunity to work with. And even if you're working and end up working with adults, this information will still help because it'll give you a context for where you can land. So I'm going to do my best to address some of the big pieces of what you've asked, but then I'll also ask you as we're moving through this time, we will and do have some protected time for questions. So if there's something specific, please write that down and capture that so that I can do my best to support you. And then I've also shared with the team that if there's something specific that you're looking for, I can also identify some additional resources and follow up with you because it's hard to talk about this topic. It's such a broad topic to that individualized aspect of what you could do, but hopefully you'll grab some stuff that will help you and support you. Thank you. You asked to talk about, you can go ahead and switch to the next slide. Talk about child life.
Stephanie, sorry to interrupt you. Can you please go a bit slow on your words? Because sometimes it's difficult for us to catch up with the accent, sorry.
No, please don't apologize, and thanks for the reminder. I think I'm trying to be very thoughtful about our time and know that there's a lot to cover, so I tend to speed up. So I apologize for that, and definitely ask for clarification. And as we move through our time and these slides, I'm going to pick and choose some of the aspects to highlight and talk with you about. And then again, ask those questions because that's really where the learning is going to go in terms of what really works best for you. So what is child life? The big idea behind child life is helping children and families cope with the healthcare environment and all healthcare experiences. So I think the most important thing to understand is that it's a professional credential. Just like we have a lot of different credentials within the healthcare environment, this is specialized within that psychosocial practice, especially for children and families. And we really look at it from both of those pieces, really thinking about that work. And it's a lot to think about, but if you just think about the word coping and helping children navigate and families to navigate the healthcare environment, that is really what we're all about. And it's a professional credential, so if you're really curious to learn more about it, our professional association is childlife.org, and it'll give you a lot more details around that process. So here's the big idea. Really for you to have the opportunity to look at children's developmental understandings and reactions to healthcare. And when we talk about the concept of death, it's really important to start with that piece of understanding what children know or understand and how they process. That's why it's a pretty big topic, and I'm hopeful that you'll walk away with at least one strategy or one approach that when you think about children that you'll be able to think about or to step back or to pause and say, hey, you know what? This is the one thing that I'm going to remember when I go into work with this child and or this family. It's really about this concept of the child, the family, and the community. And we always want to think about it from that child perspective, but that child doesn't come all by themselves, right? They come with a family and they come within the context of their community. And it's really important to think about each child and what they bring with them and how they understand. So that developmental perspective is really important. And there's different aspects of development. If we're to pick the ones that are really important, we really want to think about cognitive development. So how are they thinking? How they're thinking, how they're processing. Think about their emotional development. What's really important for them at each developmental stage. And again, that piece of family and community. And what are their what's that context? What are their beliefs? What are their values? What are their practices? What do they believe happens? What causes illness? What are their understandings of a healthcare environment? All that fits within what they're exposed to or what they understand from that developmental perspective. So we're going to go a little deeper into this. So these next two slides really give you a good detailed look at infants through adolescence. So when we think about infants, we're really looking at how do they learn, and often people will say, oh, they're just a baby. Well, what we really want to do is understand that they look at the world and understand the world through what they can see, taste, touch, smell, and experience. So it's a little bit different than what we would think about older children. Often for us in infancy, people often forget that they experience pain just as much as anybody else on that developmental continuum. How we interpret that is in a different ways, right? So we have to really look at their behaviors, how they're reacting to others, they're crying, all of those things really are help us to understand what their concepts are or how they react to a healthcare environment or a healthcare experience. So it's really important to support and maintain routines, comfort items. I know you had a whole session on play. Play is like critical. It's really at the cornerstone of everything that we do with children, whether it's a parent or even a doctor or a nurse. That play is so valuable. The importance of touch, even thinking about how we position infants and how we are holding them. Even I'm looking at, like, some of you have your stethoscopes on, and how we even do vitals and listen to a child's heartbeat. Just the nature of how we hold that infant will create a sense of comfort or support within that environment. So just some things to think about. And across the board, you're going to hear me say, always involve family, because that's so critical. And it's definitely critical across most cultural groups, and is such a strong belief for most people. Then we'll move into 1, 2s, and 3s. So we know that a 1-year-old is often different than a 3-year-old, but it gives us a good idea about some main pieces to think about. And when we think about this age group, they're really about active exploration. They want to touch things, they want to move, they want to experience it. So often, if they've never experienced or had different healthcare environment equipment in front of them, it's important to let them, of course, no needles, just checking to make sure you're paying attention, that you don't want, it's more of like a syringe without the needle, so that they can actually touch it and experience it and play with it. Most people think, well, why? But it helps them to feel more familiar with some of those medical experiencers or medical materials. So you'll hear a lot of that. In this age group, there's a lot of magical thinking. So that whole idea, they don't understand the difference between like what is pretend and what is real. So those like cartoon characters that they see on TV, they'll actually think that they're real, just like people are. So just keeping that in mind as you describe things to children. You see a lot more behaviors coming out, like crying and screaming. You may even see behaviors that are more regressive. They might have mastered a certain particular developmental milestone, maybe like using the bathroom, but then they are entered into the healthcare environment and they might regress and go back to using Pampers or nappies, depending on what's happening. Sorry, I'm just looking at our time. The other thing in this particular age group that's really important is really short, very simple explanations. I tend to really encourage language called first then. First, I'm going to listen to your chest, then you can play. So it helps them to understand what's happening in very small, short sequences of events. And then we'll move on to 4 and 5-year-olds. So you'll start to see where some of these themes are similar, but as their developmental ages grow, then their understandings begin to grow and some of the fears begin to emerge more. So they definitely take things literally. So if you are telling a child that you're going to have a CAT scan, in English anyway, a cat is a cat, it's an animal. So they might not understand that that's actually a machine that's going to take pictures. They might actually think the animal's there. And so across languages, it's important to think about what are those words that can cause misconceptions or misunderstanding. And only you'll know that because those are the languages of those children, and you want to really understand what that means for them. So that's just something to think about. They will sometimes mix what they're worried about, what they're scared about, with pain. So really asking questions and trying to understand what it is that's bothering them, it can sometimes be challenging and difficult. And especially at this age, they may think disease or hospitalization is a punishment, like they did something wrong. So it's just important to clear up some of those misconceptions. And then again, it's really about those simple explanations. Play is really critical across the age groups, but particularly for this age, it's important for them to be able to explore their environment and the materials, and to offer some level of choice and give them some level of expression of feeling. So we'll go to the next one. So school age is when a lot begins to emerge, and when we're going to dig a little bit deeper in just a minute around concepts of death, and you'll hear some more. But this is when they can begin to understand things a little bit more concretely. They can hold a series of information and sequence of events in their mind. They can begin to really identify where their pain is, but you'll begin to see more fears emerge, fears of illness, fear of death. They will have a more sense of a loss of control. And you may see behaviors start to emerge that you wouldn't typically see. One of the things that we really want to pay attention to around behavior is what's that behavior telling us, that they might not be able to say, I'm scared or I'm worried, but those behaviors might be telling us something within that. So it's just something to think about. Play is really important, time and connection with friends and family. Giving them opportunities to express their feelings, ask questions, give choice. All those things are really important when we think about that school age development. And you can see where these themes are starting to emerge across each developmental age group. And then adolescence, so we'll talk about really briefly with them for 12 to 18-year-olds, and sometimes a little bit later. This is really, they have the ability to have abstract thinking. So you can have more conversations around what's happening. They can hold concepts in their minds where you don't have to make it as concrete for them to understand, and give them more information. And this is where it's really important to understand what kinds of questions do they have, what do they need to know, or what do they want to know and understand, really addressing some of those bigger fears and worries. And then also really understanding what they like and what they don't like, and building on those likes and interests, because their play is going to look different. If you told a 14-year-old, what do you like to play? They might look at you like, why? But if you ask them what do they like to do, they might give you more thoughts about what they like to do. Maybe hanging out with their friends, playing video games. So just understanding that. Even a child who's incredibly sick will still want to do those things. And it's finding access for them in those experiences. So it just gives you, this is a lot of information, and I'm trying to go slow, but you can reference this and then dig a little bit deeper in terms of each of those age groups. So when you're working with the child and family, this is really the lens that you want to look at, is really where are they at, where's that child at developmentally, and how are they understanding what's happening, and what's their ability or capacity to be able to express themselves, so that you really understand where they are and what they're understanding. So we're going to go just a little bit deeper into this conversation. Go to the next slide. So what does this really look like in terms of children's concepts of death, and what do they understand? And this is just to give you a quick snapshot and something to begin the conversations around children's concepts of death. Now, all of this is really impacted by multiple variables. So those are what are they exposed to? What were their previous experiences before having a conversation around death? Is it about what they've only seen maybe on a cartoon or in TV? Or have they had previous experiences with a family member who has died? Have they had a peer who has died? So all those previous experiences are really important. And then also exposure and conversation. So are there family conversations in general around death? What are their religious and spiritual beliefs around even just having a conversation about death and dying? it's there's so much to consider, to know and understand, so that as you support a child and a family through their process, these things are all really critical before even beginning conversations. So for just to give you just a little bit of a understanding, for infants to about 2 years old, we really see that they don't necessarily have the concept of death, but what they do understand is that something is missing, or there's a sense of loss, and they often will react to the feelings of the people around them. So if people are crying and really upset, you might see an infant mirroring some of those reactions or emotions. And then 3 to 5, they think that death is reversible. So that's that whole idea that they think that somebody will die and then they can come back. I've had a very good friend of mine who worked with a 5-year-old once, who asked if they could get in the car and drive to heaven so that they could go see this person, and then they would come back. So I always share that example because I think it gives a really good concrete understanding of, they think it's actually somewhere you can go and then come back. And they might even see death as punishment. So it's just really important to clarify, make sure they understand what's happening. And often there's a repetitive nature that has to happen because they hear it and they can go play, and then they will need to come back. So it's that ongoing conversation and expression of feelings. And around 6 is when the understanding that death is final begins to really emerge. And some children capture this a little earlier and some a little later. It really depends on what they're exposed to and what their experiences are. But from a cognitive perspective, developmentally, we believe that this really happens around the age of 6 and sometimes a little bit later. But that's like your starting point to understand that they get the bigger concepts of death. And then 7 to 12, you see that develops deeper, and that finality of death, the irreversibility of death, that the body stops functioning when it dies. All of that comes to really a deeper understanding around that 7 to 12. And then of course, 13 and young adults really have a deep understanding of death, and then can really understand its impact on others. And if they're not the one who is dying, they may even be thinking about their own life and their own impact on what's happening. You know, it's a lot to understand, but those are the big ideas. And then these are the general concepts that we just spoke about. So that irreversibility, the non-functionality, so that idea that the body does not feel, does not need to eat anymore, is another piece of that process of understanding the death. And then universality, meaning that all things eventually die. And that you have living and you have dying, and that process really comes as that older school age child begins to develop that deeper concept around death. And then of course, causality, and that abstract aspects of death are really difficult for young children to understand. So we try to make that very concrete. So things like the body can't do its job anymore, making it very literal for children that helps them to understand it. And then as they get older, especially within that older school age and adolescence, they can have more of an understanding around the death. So there's lots of things to think about and a lot of different strategies. And these are general things to consider. And of course, each situation scenario is going to apply it a little bit differently, but hopefully some of these things will give you some strategies to consider or to think about. A lot of people in the conversations around death and dying do not like to use the word death, dead, or dying. From a developmental perspective, we really encourage that because it's a really important way to understand what's happening. Oftentimes people will try to say go to sleep, or they're lost, or they're watching over you. And for young children especially, those are concepts they go to sleep at night and then they wake up. So it can be really confusing when we use those types of words. So the more concrete we can use the language around death and dying is really important. Being honest. And I always say this is, I call it the being honest in a way that a child can understand it versus the way that we as adults might need to understand. So again, really simple explanations are really important for children to really have that concept or understand what's happening. We talked about this earlier, but questions will often repeat. So it's really important to keep the explanations simple, but also the same type of explanation so that children aren't asking multiple people what happened and then getting multiple answers and then then them having to navigate that truth, and that's really difficult. Often children will ask questions, but it's not really what they're looking for. So it's important to clarify what is it that they want to understand more about, and then respond to that question. And sometimes us as adults will want to give them more information, and it may not be what they're looking for. The other piece is I always talk about is listen also in the process of being quiet. So just being still with a child and allowing them to talk through it. Sometimes they need to pause or silence to really be able to process what they're saying. And sometimes they don't need an answer, but they just need somebody to listen. So that process and that time is really important. Routine's really important. And so maintaining some of that routine for children is really critical. Understanding how they've previously coped so that you can pull from or support those previous coping strategies. We talked about this earlier, but understanding what their experiences with death, so that if they have had those experiences before, it's important to understand, because they might generalize one experience to the other, and that might not always be the case. So I always think about, like, if a child has cancer and they've had an adult in their life who's had cancer and that person has died, then they might think that all people who have cancer die, which we know is not always true. So it's important to understand that there's multiple kinds of cancers. There's cancers for kids, there's cancer for adults. And so helping them to understand that is important. And then it's okay to say you don't know. My favorite strategy is, let's write down all the questions you have. And then that way you get an idea about where that child is coming from. And then you can, of course, you all probably have a lot of the answers, but then that you can navigate what's the best approach. And sometimes you are going to need to check with the parents, because the parents might have a different way of how they want to address something. Comfort items are great, especially for a brother or sister. They may want to have, like, put the teddy bear on there, may want to have a keepsake or something from that sibling who is either dying or who has died, and that they want to connect. So that might be something that might be a great way for them to stay connected or to have a memory of that sibling. One more slide on strategies. Play. I can't echo this enough. Some children need to play and be able to continue to do what they were normally doing. And I think that that's really important, especially if that's the surviving, like, sibling. But even in the dying process, children still want to play and still want to engage. So creating access for them. Creating opportunities for expression, talking, telling stories. Creating those spaces again for questions. Drawing, just paper and crayons or paper and markers are a great way. Sometimes children don't have the words to express themselves, but drawing and creating can give them a lot of ways in which they can express themselves. Letter writing, I've used this a lot, especially with older school-age children and adolescents. Encouraging them to write letters to loved ones or draw pictures. Sometimes they're not, if it's a child who is in their dying process and they don't feel well enough, they may want to dictate or tell you. And I've used that, and it's been a really powerful way for them to be able to express themselves. And sometimes they don't have the feeling that they can share something with a family member, but being able to write it out is a really powerful tool. Memory boxes are great. So those can be done in a lot of different ways. They can be done with a child during the dying process and putting memories together. It also can be for brothers and sisters, cousins and family members to collect and put memories together. So when they're missing that person, then they can go back and pull the box out and sit with the box and tell stories and talk about those things in the context of their memories. I put the word environment on there because creating an environment or a space where children feel comfortable to ask those questions or to be present with you is really valuable. Encouraging families to do things together, connect, and be together in small moments or in big moments, depending on what they want, are really important. We talked about this earlier, but the behavior is really important, and you may see regressive behaviors depending on the context of what's happening. So just paying attention to what that means. The last two are reassurance that they will be taken care of. So if it's a child whose parent is dying, or even a sibling, just that surviving child really needs reassurance that they're going to be taken care of. And then on the other side of that is when children are dying, they're often worried about their parents or the loved ones that are there, and they want to know that someone's going to take care of them, and they need that reassurance as well. So there's lots of different ways in which we look at this, and depending on the context and what's happening will depend on the strategies or the supports. So I think we have just a couple more minutes and then I'll open it up for questions. So a couple of the questions that often people ask, and when I asked about what you all would really appreciate is these two sets of questions is when a child says, "What's wrong with me? Do I have cancer? What do you do?" Some of us sit there go, "Okay, wait a minute, hold on." And you want to kind of pause. I'm going to answer this from a general perspective, and what I really would encourage is you to think about all that we've talked about in the last 20 minutes around how children understand and process information. But the most important thing is to really begin with the family, because some families don't want to use certain words. And what we typically do is really want to encourage the children to use the word cancer. Most of the time, if children are asking this question, they've probably already heard the word, and they've probably already heard conversations. So it is important to be honest, and you can even just ask some clarifying questions, like tell me about what you understand, or tell me about what you know. And it's okay to do that, because then you're really understanding where they are. But being honest, yes, you do have cancer, and there are different kinds of cancer, and your cancer is called. Helps them to begin to understand that. Young school-age children will often think like cancer is contagious, like a cold or a flu. So clarifying that and making sure they understand that, that's probably one of the biggest misconceptions. And if you ask them some open-ended questions about what they understand or what they know, that helps you to know what they're thinking, and then you can help clear those misconceptions as well. The other piece of, processing. The other piece is just thinking about what the nurses and the doctors are doing to help them, and giving some concrete information, like you're getting medicine called chemotherapy. The chemotherapy's job, what's the chemotherapy's job, right? It's to go and get those cells that don't belong in your body, and those cells that don't belong in your body are the cancer cells. And often when we talk about cancer, you can talk about the different types of cells in their body and what those cells do. Like, what are the red blood cells' job? What's the white blood cells' job? What's the platelets' job? And those types of conversations help to have a context for the whole conversation. I know this is a lot, so hopefully you're grabbing some things that will be helpful for you. And the last question that children have often will ask is, am I going to die? So the question becomes like, where does this question come with? Is it come with do I have cancer? Am I going to die? Is this question come at the end where like that you've done absolutely everything you can for this child, and they're really at their end of life, and they are really in that process of dying? Depending on where they are is really going to help you to understand how to really best respond to this question. And again, I will say it really does come back to the family. What do the family want to know, or want that child to know and understand? And being honest with children is really important. I think that it's important to understand that when you respond to this question, that the doctors, right, we are doing everything and have done everything we can to help your body to get better. Well, the medicine can't help you anymore, and this is what we're going to do to help you. So we're going to help you be comfortable. We want you to continue to do things that you like, and so you talk about what those things are, and that helps to have those conversations. And really clarifying what they want to know or understand, because sometimes they're not really asking you if they're going to die. They're asking about something else. So you, depending on the age, you may ask, why are you asking this question? Or tell me a little bit more about what you're asking. Help me to understand, or help me to understand what you know about what's happening to your body. Because most of the time children know, and we'll begin to have conversations or share things that tell you that they do know or they do understand. And they're processing things on a deeper level. And if we give them the opportunity or the place to have those conversations, it's really a great and valuable place for them to be.